proton therapy centers are a LINAC times 1,000, we say. It means they're a lot more complex and they have different planning considerations than a LINAC. I am finishing a project right now in Milwaukee that is a proton therapy project. They started the project without proton knowledge on the team. Then they asked me to come in and evaluate the project after it had started, and I discovered that they were designing a proton therapy center on stilts. The reason that they were going about it that way is because that's how they had done all their LINACs. Well, it's okay to do that with a LINAC, but they didn't really understand that proton therapy equipment weighs 1,000 times more. And you quite literally can't hold it on columns. There's so many differences in a proton therapy center from a LINAC, and the variables are things like, I mentioned the weight of the equipment, also the size, it's much bigger. But even things like the shielding. Some walls are 14 foot thick. A LINAC is never that thick. Also the doors that shut a LINAC room, they're very thick and they're very heavy doors, but nowhere near a proton. So when we interview contractors and we interview architects and engineers, they have to approach a proton center as they would approach any new project without preconceived ideas that it's similar to, say, a LINAC project, because it's really not.